The medical community is locked in a public relations battle against Health and Human Services Secretary Robert F. Kennedy Jr. as students return to school across the U.S. with conflicting advice on COVID-19 vaccines creating widespread confusion. The American Academy of Pediatrics, AAP, has issued more detailed guidelines for children than the Department of Health and Human Services, HHS, revealing growing tensions between doctors and federal health authorities. Parents navigating these conflicting recommendations now face an increasingly complex landscape of guidance. For children aged 6 months to 11 years who are not immunocompromised, the CDC recommends shared decision-making with doctors, leaving parents to decide. However, the FDA recently approved Moderna's COVID-19 shot for children with underlying conditions, while excluding healthy children from its approval, complicating access for otherwise healthy kids. The AAP advises shared decision-making for most children, but recommends vaccines for at-risk groups, including those who have never been vaccinated or live with high-risk individuals. The AAP itself maintains its own immunization schedule, recommending 1 or more doses for all children over 6 months. Ulrich von Andrian, president of the American Association of Immunologists, urged parents to consult trusted healthcare professionals to navigate the guidance. Kennedy's earlier push to halt routine COVID-19 shots for healthy children, citing insufficient clinical data, has sparked debate. As a vocal vaccine skeptic, Kennedy petitioned the FDA in 2021 to revoke emergency use authorizations for vaccines, citing thousands of deaths from the virus. While the CDC still recommends annual influenza vaccinations for children, RSV monoclonal antibodies are advised for infants 8 months to 19 months. Prior to Kennedy's appointment, the AAP often collaborated with federal agencies on immunization policies. But after Kennedy gutted the CDC's Advisory Committee on Immunization Practices, the AAP chose not to engage in what it called an illegitimate meeting this summer. Other medical groups, like the American Medical Association, welcomed the AAP's guidance. Von Andrian praised the collaboration, stating, "It is critical that the public and healthcare professionals have access to credible, trustworthy information about immunizations to make informed decisions." In a recent meeting, CIDRAP's Vaccine Integrity Project discussed scientific findings supporting COVID-19 vaccines for high-risk children. Director Michael Osterholm emphasized that AAP recommendations align with current literature, noting that other societies will follow suit. Americans will have evidence-based recommendations from clinicians who care for these patients, he said. Critics of Kennedy's decision argue that not recommending vaccines for healthy children aligns with current evidence and global guidelines. Monique Yohannan, a physician at the conservative nonprofit Independent Women, noted that the World Health Organization, WHO, and other countries share Kennedy's stance, despite not recommending routine revaccination for healthy children. "We were the only country recommending this vaccine for healthy kids," she said, calling the AAP's position an outlier. Yohannan warns that the vaccine discourse could spill into broader conversations about vaccinating against other illnesses, which she believes are more urgent. As school season approaches, parents must revisit measles vaccination priorities, she urged. In recent years, the U.S. has fallen behind in measles vaccine coverage, with nearly half of Texas students exempt from vaccinations after a recent outbreak. This highlights the urgency of addressing vaccine hesitancy and ensuring public health protection. Copyright 2025, Nexstar Media Inc., all rights reserved.